Experts around the world have been debating if COVID triggers blood clotting in patients or not. But now a senior doctor from Delhi's Sir Ganga Hospital has posted this image that's going viral. It's on your screen right now. This is an image of a blood clot that was removed from a COVID patient's leg. This image has been shared and retweeted thousands of times on social media. Now, blood clots are turning out to be a very serious concern as it increases the risk of heart attacks, strokes, and the possibility even of a limb having to be removed as a result of the blood clot. A blood clot or a thrombus increases the risk of complications and could even possibly be fatal to those with COVID. But there are questions. We don't want to alarm you, and that's the reason why we've invited onto our show today Dr. Ambarish Satwik, who's a vascular surgeon with the Sir Ganga Hospital. He is the doctor who himself extracted that blood clot you saw in that image. He's the doctor who tweeted that image. Dr. Satwik, pleasure to have you. We've all seen that image. Thousands of people have been sharing it, with a sense of morbid fascination, but also with a sense of nervousness because of what the implications really are. Could you describe for us what is in that picture, Dr. Satwik? How did you extract that? Just describe that image and what it implies.
So what you're seeing in that image is a series of clots which were retrieved from the arteries of the lower limb of this patient. This was a patient of COVID who had developed what is known as limb-threatening ischemia, which is a sudden circulatory cutoff in the lower limb. This is because of these clots or plugs which form in the arteries of the lower limb, and this is an idiosyncratic feature of COVID. What had happened was that, we've been learning on the fly as regards COVID, and when we first started hearing about these cases coming in, there was an uncharacteristically high correlation of thrombosis or clotting that was seen in these patients. And we were following reports that were coming in from New York and from Italy. And there were very disturbing reports of young people in their 30s and 40s suddenly developing strokes and heart attacks. And in fact, at the height of the epidemic in April in New York, the New York Fire Department was picking up 4 times as many people who had died of strokes than was usual. And then more and more work was being done on the pathophysiology of COVID, and it was discovered this is largely a vascular disease, which means that the virus is hitting and attacking the blood vessels as much as it is attacking the lungs.
Yes. In how many cases, Dr. Satwik, are you seeing clotting of this kind actually happen?
So these clots, if I were to kind of unpack the basics for you, a clot in medical terms is called a thrombus.
Yes.
Colloquially, it is called a clot. Now, this is the final product of a process known as coagulation. Now, when someone bleeds, if there's an incision in the skin, you will notice that the bleeding stops. And this is an account of coagulation, which what that means is that liquid blood first turns into a sort of gel, and then there's a seal or a plug that forms that stops or staunches the flow of blood.
Yes.
Now, if these clots were to develop on their own inside of blood vessels, rather than as a response to injury, they will actually form a cast inside the blood vessel and cut off circulation to a certain organ, or will cut off drainage of blood supply from that organ. Now, it is noticed that when these clots are forming in the veins, which are the blood vessels that are draining a certain organ, the correlation with COVID is as high as about 14 to 25 to 28%, particularly high in moderate and severe COVID patients who are admitted.
Right.
But if a clot is found in the arteries, which is the sort of blood vessel that supplies blood from the heart to various parts of the body, the rough incidence of these clots in association with COVID is about 2 to 5%, which is a significant number.
Dr. Satwik, how long after a COVID diagnosis is a condition like this seen? The picture that you've put out appears to be quite a severe clotting that's taken place in someone's limb. How long after a COVID diagnosis are you seeing this kind of clotting take place?
Well, it could happen in active COVID because the virus is attacking the lungs. And the nearest neighbor in the air sacs of the lungs are the blood vessels.
Yeah.
So the virus also attacks the inner lining or the endothelium of these blood vessels. And in fact, some of the consequences that you're seeing in the lungs, more than respiratory distress syndrome or pneumonia, is also an account of microthrombi or microclots that are forming in the circulation of the lungs. So if you were to say that how frequently is it happening in the lungs, it's happening in practically every case of severe COVID. But how frequently is it happening in the peripheral blood vessels, that incidence is what I had described. But to answer your question, it can happen usually at the cusp of the first and the second week, when the virus is actually is attacking and the immune response is also mounting. So it's like a category 10 hurricane that is taking place inside of the immune system. And it's like a military response to stamp out the virus, which causes collateral damage. So usually at the cusp of the first and the second week, but also in severe cases of COVID in the second week, or sometimes even in the third week, that you notice these cases of thrombosis.
Okay, so it can happen during active COVID anytime between the first and the second week, and also when it is severe. So that is useful information for people out there who are tuning in and listening to this. Just curious, Dr. Satwik, in this particular operation where the picture that you've tweeted out of that clot that you pulled out of a COVID patient's leg, what did you need to do after you pulled out this particular clot? Did you need to put in a stent or something like that?
No, we normally don't require a stent. This is just pure plumbing. You're basically cleaning the drain pipes. Right. There are various ways you can do this. You can do this by an open surgical procedure. Sometimes you can do it with endovascular techniques, which is what we employ, which are minimally invasive techniques to kind of suck out these clots, or sometimes instill very powerful thrombolytic agents, which are drugs that practically lyse or dissolve the thrombus.
Right.
The challenge is to actually keep these blood vessels open after you've extracted the clots, because, as I said, this is not a process of pure thrombosis, it's immunothrombosis. It's the virus along with the immune system that is causing these clots to form. So you might have to put these patients on very high levels of blood thinners and keep infusing these patients with ongoing blood thinners, or sometimes even stronger agents, to make sure that these clots don't form in these blood vessels again.
Dr. Satwik, this particular blood clot that you pulled out was from a COVID patient's lower limb, their leg. What other blood vessels are you seeing clotting taking place in, and what are the possible consequences of this clotting? You've touched upon it in your tweet. Can you tell us a little bit more about what the other consequences could be?
So, both arteries and veins are affected. Veins are the blood vessels that convey blood back to the heart from various parts of the body. And in case you develop a clot in these blood vessels, it's called deep venous thrombosis, or DVT. And sometimes these clots that form in these veins can break off and travel to your heart and lungs and cause a lethal condition called pulmonary embolism.
Right.
So these clots can develop in the veins or in the arteries, which are blood vessels which take off from the heart and supply various organs. So they can form in the coronary arteries, which are the arteries that supply the muscle of the heart itself, which can cause a heart attack, also known as acute myocardial infarction. It can form in the blood vessels that convey blood from the heart through the neck to the brain and cause a stroke. It can form in practically any of the visceral arteries, which means the arteries that supply the various internal organs of the body, like the kidneys or the intestines and so on. And it can affect blood vessels that supply the extremities, the upper limbs and the lower limbs.
Yeah.
And, depending on what organ is affected, there will be varied manifestations. What we aren't entirely sure is which patients are typically susceptible to these clots?
I was going to ask,
because we still haven't cracked that one. And as I said, we're kind of learning on the fly because we're still learning about the molecular pathophysiology of why this is happening and how to prevent it. Because we find that in many patients who've been put on prophylactic doses of blood thinners, you still are finding these clots. So perhaps it is something to do with a particular genotype or an inherited mutation in humans, in subset of people, which might be contributing to this. But we still haven't narrowed in on why. And in which subset of people are you likely to develop these complications?
It's quite unsettling to learn that this is still work in progress, but so much of this pandemic really is. Doctor, what can COVID patients, because I know people are going to be very, very interested. We've heard about incidents of, blood clotting, of heart attacks taking place even in young people. What can COVID patients look out for? What are the, the danger signs that they can look out for so they can alert doctors or their caregivers, for this kind of situation?
So usually on day 5, particularly in cases of moderate COVID or mild COVID progressing to moderate COVID, when symptoms are kind of escalating, you tend to get a series of blood markers or inflammatory markers done.
Right.
And depending on what these results will reveal, we might have some indication if there is any role for starting prophylactic blood thinners. And it's usually those patients where the inflammatory markers are completely off the charts. Are you likely to find a severe inflammatory response mounting in the patient's body? And that could be one of the reasons for these clots to develop. So keep a close watch on the inflammatory markers would be one thing. Secondly, any new symptom that the patient might be developing while they're suffering from COVID in the first or the second week should be immediately reported to their primary care physician and needs to be investigated. So in case of venous clots or deep venous thrombosis, commonly you'll encounter swelling and pain in the extremities, particularly the lower limbs. In case of arterial thrombus, there would be pain because there is acute circulatory cutoff of that part of the body. So if, let's say, there's a clot that forms in the blood vessels in the arteries of the upper limb, there'll be severe pain, numbness, tingling in the upper extremities, in the hand or the forearm. If it's the lower limb, there'll be a similar set of complaints in the lower limb, severe, excruciating, sudden onset pain, numbness, loss of function. The limb would be cold to touch. If it's visceral, which means of the internal organs, there'll be a sort of abdominal angina, sudden onset abdominal pain, which is, again, not responding to your usual set of medicines. If it's a cardiac set of symptoms, then that would include pain and a sense of tightness and constriction in the chest, or pain from the chest that is radiating to the left arm or the jaw or the back sometimes, palpitations, lightheadedness. These are the set of symptoms that you must watch out for if you are suffering from COVID, and immediately report to your physician.
Dr. Satwik, are there any conditions that predispose patients, of COVID to this kind of condition, to thrombosis and this kind of condition?
Well, usually, patients who have some sort of cardiovascular morbidity will there'll be a slightly increased risk of developing these complications. That would include type 2 diabetes, hypertension, known case of previous thrombosis, perhaps obesity, increased body mass index, and a combination of all of them. These would be high-risk individuals.
Are there any preventive steps that one can take, or tests that a patient can take to alert ahead towards the possibility of thrombosis or clotting or anything that you've just described, doctor?
Well, there's nothing you can do to actually prevent a clot from forming. As I said, usually if your fever is not abating, on day 5 you get a set of inflammatory markers done, particularly if you satisfy the high-risk criteria. And if your markers are elevated, you should consider consulting a physician and perhaps starting a blood thinner if required. adequately hydrate yourself is the only advice that I'll give. But there's nothing in the realm of prophylaxis that patients can do to actually prevent a clot from developing. Of course, obviously you shouldn't smoke while you're suffering from COVID or drink excessively and all of that.
Okay, so don't smoke when you have COVID. Very, very important, especially for those who are, in home isolation and are free to smoke if they wish it to. So that's a very important piece of advice there. Is there any particular age group that's being affected, doctor? Because we're seeing young persons have heart attacks as well in this second wave. Is there any particular age group you're seeing thrombosis or blood clotting more in?
No, there isn't. We've seen these cases in individuals as young as 30 to perhaps 92 years of age, and we're getting a whole lot of this. This week, I've done about 4 of these. One of them causing intestinal ischemia or a blockage in the main artery supplying the intestine. 3 of them of the extremities.
Yes.
A lot of my colleagues are also, getting cases of acute heart attacks. Usually the cardiologists handle that. And stroke is also our territory. So we're getting a whole set of cases who've developed acute stroke during their COVID hospitalization. But there isn't a particular age group that is vulnerable. As I said, we still haven't cracked what kind of individual is susceptible to these complications, because COVID exists on a kind of spectrum. You have sometimes octogenarians who merrily escape any complication of the disease, and sometimes you have seemingly fit individuals, athletic in build, who might suffer the worst and the most turbulent complications of COVID and might even cop it in the process. So it's very hard to identify which one is going to end up with this. It's something of a Russian roulette, if you might call that. But of course, as I said, there will be some preliminary indication if your inflammatory markers are rising and rising very rapidly. So I think in any case where symptoms are not abating, particularly in the end of the first week, I would insist you keep in touch with your physician and perhaps start tracking these inflammatory markers, and definitely report any fresh symptom anywhere in the body that might be developing if you have COVID.
One final question, Dr. Satwik, just zooming out from the clotting conversation that we've been having. It's been over a year in this pandemic. We remember all the advice that's been on for, over a year. Lots of people don't follow it. Washing hands, wearing your masks, wearing masks inside the house, social distancing and that kind of thing. Are there any new learnings, any new advice that you can share? You're in the COVID trenches every day of your professional life for the last year. Is there any more advice that you can definitely give to the public at this point of time?
Well, therapeutically, we've learned how to handle this disease. We've made great strides in the management, and we're able to offer much better outcomes as regards patient salvage. But I think when it comes from the perspective of patients, I think they'll be well advised to remember that there is no benign case of COVID. You really don't know how every case of COVID is going to turn out. You don't know the consequences, you don't know the outcomes. So don't take any case of COVID as a mild illness or a mild infection unless you're out of it. So you have to be wary, you have to be vigilant, you have to be aware of the complications, and be constantly in touch with your physician.
Dr. Ambarish Satwik, this has been an incredible learning experience. I've learned a lot, and I'm sure our viewers have as well. So thank you for giving us your time. Please stay well, and we will continue to look out for the things that you put out and share with the public, because nothing comes close to a doctor who's in the trenches of this pandemic and giving us insight into the understanding of this disease. So we salute you, and we thank you, Dr. Satwik, for taking the time out to be with us here on India Today. Very quick break.